And how many personnel through this medical services request do you intend to employ in FY26?
At the current, and I also have, I have my budget, Andrew, here as well, if there's the numbers that we need, if, Mr. Chairman, with yours. The issue that you brought up is, right now, there are currently 465,000 employees in VA as a whole. VHA has 409,000 of those.
I'm so sorry, Mr. The question is, how many staff do you intend to employ through the medical services budget in FY26?
Do we, Andrew?
396,000?
396,000.
396,000.
Yes.
Okay. The FY25 request, and just to be clear, that's intended staffing of medical services in FY26? Say the number again.
395?
396,000.
396,000.
396,000. Okay.
Yes.
How many physicians do you intend to employ in FY26?
Physicians.
Physicians, we employ a large number of physicians.
I'm sorry, who are you?
In a tense Senate budget hearing, Senator Jon Ossoff pressed Veterans Affairs Secretary Collins over the department's FY 2026 budget request. At the heart of the exchange was a proposed $17 to $18 billion cut to VA medical services, a category that overwhelmingly funds personnel, from physicians and nurses to support staff. Ossoff demanded clarity on how many doctors, nurses, and other medical professionals the VA intends to employ, and whether these cuts would translate to firings or reductions in care for veterans. But Secretary Collins, citing incomplete data and ongoing budget reviews, repeatedly deferred answers, fueling concerns about transparency and the true impact of the administration's proposal on America's veterans.
Thank you, Mr. Chairman, and thank you again, Mr. Secretary. So just to start with the basics here, Mr. Secretary, the total all-in request for FY26 is $441.2 billion, correct?
Yes.
Okay,
Yes.
and how much of your medical services request is for personnel? And how many personnel through this medical services request do you intend to employ in FY26?
At the current, and I also have, I have my budget, Andrew, here as well, if there's the numbers that we need, if, Mr. Chairman, with yours. The issue that you brought up is, right now, there are currently 465,000 employees in VA as a whole. VHA has 409,000 of those.
I'm so sorry, Mr. The question is, how many staff do you intend to employ through the medical services budget in FY26?
Do we, Andrew?
396,000?
396,000.
396,000.
Yes.
Okay. The FY25 request, and just to be clear, that's intended staffing of medical services in FY26? Say the number again.
395?
396,000.
396,000.
396,000. Okay.
Yes.
How many physicians do you intend to employ in FY26?
Physicians.
Physicians, we employ a large number of physicians.
I'm sorry, who are you?
Andrew is our budget. Right now, we currently have 28,868 physicians.
Yeah, so how many physicians do you intend to employ in FY26?
We're not cutting physicians, so at this point in time, under that budget, we're still looking to continue at 28,868 at minimum, because we're also having to add physicians which are exempt. So we're adding
here's
those.
what we usually.
And because
This is, for example, the budget request from 25, and it specifies that for 25, we're requested 25,099 physicians. So we usually get this in advance of this hearing. So my question is just how many doctors you intend to employ.
yeah, and at this point in time, I'll take that and get it back to you. As I told you yesterday on the phone, there'll be some more information coming later this week.
Okay, how about dentists?
Same answer.
Do you have the number for nurses?
We currently employ 91,040. I'll have the.
But my question is how many?
And I understand, and the breakdown will be provided as I said yesterday.
Okay, well, how have you calculated the money you need for personnel without having yet decided how many personnel to employ?
In the breakdown of the budget, which right now is still going on, these are the numbers that we are using to go forward from last year's budget into this year's budget. And at this point, there is also a gap in how many we have currently hired and not hired. And so at this point, I'll have the numbers for you that we've not provided yet. We'll be providing those numbers.
But you've proposed about $17 or $18 billion cut to the medical services account, correct?
That is not, the president's budget makes adjustments to the funding that devote additional funding appropriate fund to community care. This is not a cut to
No.
total to funding to VHA. In fact, the total medical care budget grew by 17% to $24 billion.
Not medical care, medical services. So here's your,
Okay.
just to be clear, I mean, the chairman mentioned this, we usually get
I understand
Yes.
completely.
specifies how many folks you intend to employ. We
Yeah.
have a 26-page PowerPoint, but in that 26-page PowerPoint, here are specified about $17 billion in cuts to the medical services budget. So what are you cutting in medical services? Specifically, who are you cutting, since that's exclusively personnel?
Again, and this is the issue that we have right now, and I'll just state this for either of us to go back in circles. We'll be providing more of those numbers, as I said yesterday on our phone call this week. So at this point in time, the numbers that we're providing are the numbers that we have at this point. I'll be happy to talk to you further about those later.
And understand that's why we usually get these in advance of this hearing. I mean, I'm wondering if we need to reconvene having received the full budget request. Because the thing that is causing a lot of consternation is this proposed $17, $18 billion cut to medical services. I mean, and so today is the budget hearing where you justify the budget request. So how do you justify this cut to medical services, and who are you going to fire in order to pay for it?
And I'll go back to the same answer I gave you just a few minutes ago. I mean, in this process, we'll have the more information on that part of it as we go forward. The basis of the budget was based on our workforce as it existed and moving forward, and the numbers have not been cut to the medical
I'm sorry, yes,
the
it
care
has.
budget.
You have in your PowerPoint here $17 to $18 billion in cuts to medical services. Again, this is a 26-page PowerPoint to justify the budget. So, and this is the budget hearing. So who's getting fired? I don't know, Mr. Chairman, if we need to reconvene after they send us the materials, but I think this is insufficient. Clearly, and I'll follow up in my next round. Thank you, Mr. Chairman.
Senator Fisher.
Budget hearings are designed to provide lawmakers, stakeholders, and the public with clarity about how taxpayer dollars will be spent. For the Department of Veterans Affairs, VA, these hearings are especially consequential, since the funding directly shapes the medical care, benefits, and services available to millions of veterans. In the recent hearing, Senator Jon Ossoff zeroed in on the FY 2026 VA Medical Services budget request, which totals part of a $441.2 billion overall proposal. From the outset, Ossoff's line of questioning was precise. How many personnel are funded through the medical services request? How many doctors, nurses, and dentists are projected to be employed? Secretary Collins answered with generalities, confirming that the VA currently employs approximately 465,000 staff overall, of which 396,000 fall under medical services. When pressed further on specifics, Collins cited roughly 28,868 physicians and over 91,000 nurses, but admitted that updated staffing projections for FY 2026 were not yet available. This lack of clarity immediately raised alarms for Ossoff. Budget requests typically come with detailed staffing projections in advance of hearings. The absence of such information, paired with a 26-page PowerPoint presentation showing an explicit $17–18 billion cut to medical services, left lawmakers questioning what exactly would be reduced. Since medical services funding is almost entirely directed toward personnel costs, Ossoff posed the question plainly: who is getting fired? Collins avoided giving a direct answer, reiterating that numbers were still being finalized and that more details would be provided in the coming week. He emphasized that while adjustments were being made to community care, the total Veterans Health Administration budget was actually growing to $24 billion. Still, the distinction between community care reallocations and medical services reductions was not clarified in a way that reassured the committee. The exchange underscored a deeper issue: trust and transparency in government budgeting. For lawmakers, vague promises of more numbers later do little to address concerns when veterans' healthcare staffing is at stake. Ossoff highlighted that this hearing, the budget justification hearing, was precisely the forum where these details should already be available. Without them, the committee cannot properly assess the impact of cuts or ensure that veterans won't face reduced care. This moment also spotlighted the tension between fiscal restraint and service delivery. On paper, an $18 billion cut sounds like belt-tightening. But when that reduction comes from medical services, which employ doctors, nurses, and caregivers, it can translate directly into longer wait times, fewer available appointments, and greater strain on the healthcare workforce. For veterans relying on VA hospitals and clinics, such shifts could mean a tangible decline in the quality and accessibility of their care. Ossoff's persistence, asking repeatedly for staffing numbers, demanding to know how personnel costs could be calculated without knowing headcount, and questioning whether the hearing should reconvene once the data was provided, reflects a broader concern. Congress cannot evaluate trade-offs without transparency. If the VA is cutting community care while expanding in-house staff, that's one policy choice. If the agency is shrinking frontline personnel to offset budget gaps, that's another, one with far more direct impact on veterans. The unanswered questions left hanging after the exchange point to a likely continuation of this debate. Congress, veterans advocates, and the press will demand to see the detailed breakdown of staffing and services. Until then, suspicion remains that the cuts, however labeled, could risk undermining the very mission of the VA, ensuring that those who served receive the care they've earned. Senator Ossoff's sharp questioning highlighted a core tension in public budgeting. Numbers on a spreadsheet are meaningless without context. For veterans, the difference between a budget that grows in total but slashes medical services can determine access to timely, quality care. Until Secretary Collins provides full staffing projections and a transparent justification for the proposed cuts, doubts will persist. As lawmakers revisit the issue, the question will remain simple but urgent: who, if anyone, is being cut? And what does that mean for veterans who depend on the VA every single day?